Hello, my name is Elizabeth Ruiz, and for this Pecha presentation, I will be discussing the challenges of multidisciplinary clinical integration into healthcare organizations. Clinical integration is where care by professionals and providers to patients is integrated into a single or coherent process within and/or across professions, such as through the use of shared guidelines and protocols. The essence of clinical integration is the coordination of care of an individual patient and groups of patients over time. Clinical integration occurs at three different levels. The direct patient level has a goal to provide a seamless experience for the patient and their family. Next is within the service line or institution where an organizational standard of care is employed. And then the last level is the integrated delivery system where a standard of care exists for all entities within the entire health system. Clinical systems often support the technology and systems of clinical integration. The common denominator throughout clinical information systems is the patient. Clinical systems have transformed the ability of healthcare systems to provide clinical information everywhere and anytime it is needed to everyone who is appropriately associated with the care and management of the patient. Care management is a sophisticated and interdependent process that plays an important role in clinical integration. Care management combines clinical, fiscal, and information science to manage the continuum of health to achieve the optimal clinical outcomes at the best price with the highest degree of patient satisfaction for a specific population. There are four core components or four pillars integrated within this care management process for clinical integration. The first component is having a clinical pathway or care map tools with the concomitant variance management system. A care map system is a multidisciplinary plan and record of care designed for a case type or population of patients. Pathway use, in this case clinical pathway systems, is emerging from the inpatient setting and being employed in other health delivery settings such as ambulatory, home, and long-term care settings. Clinical pathway development represents a collaborative effort of its authors, which are clinicians from relevant disciplines, departments, and agencies. Clinical pathway development teams are responsible for examining care delivery in a new way by challenging traditional practice patterns in all settings performed by all disciplines to anticipate potential complications while strategizing creative interventions to prevent occurrence and to identify the key variances to be tracked and monitored over time. The second component integrated within this care management process is having collaborative group practices that report to a care center or service and assume accountability for fiscal and clinical outcomes for a defined group of patients. The third component is case management, which is the coordination of services for complex patients and their families. Case management, along with other newly developed roles, work to promote clinical integration. They function in a matrix model within the health system to promote clinical coordination and integration of care for complex patient populations over the health continuum. The case manager's role within this integrated delivery system is to provide expertise in the development of care delivery services across the many venues of care, and to manage patient populations using the most appropriate services and service locations to achieve desired patient outcomes, and to refine care delivery processes to maximize quality and cost outcomes. The fourth component is having a shared integrated information system with clinical documentation of the plan of care, variance management, monitoring of clinical and cost performance measures across the episode and continuum, and provision of programmatic data management with a decision support capability. Clinicians, as they articulate the requirements to support the care coordination process, have a desire for an integrated medical and health record over the continuum of health, ongoing support for the multidisciplinary plan and the record of care with clinical decision-making capabilities, and the need to analyze and manage outcome data that support clinical practice changes for a population. Integrated health records are paramount for clinical integration. These records contain longitudinal, critical patient information that would help clinicians manage care between and among entities within the healthcare enterprise. They are highly valued by clinicians and patients because they don't have to repeatedly ask for basic information. Why is clinical integration important? Well, clinical integration can improve the quality of healthcare services delivered, it can save money, and keep patients and communities healthier. But bringing physicians and other health providers together under one so-called umbrella can raise antitrust concerns. One concern with integrated care is whether or not this could act as a disruption to innovations needed to improve organization performance, especially if there were competition amongst the integrated care organizations. Rest assured that high levels of care coordination can be achieved both within integrated organizations and between different organizations working together in networks. A problem that may arise for clinical integration is the current structure in a healthcare system that it is trying to be integrated into. Organizational integration may occur due to structural organization of provider integration that failed to alter the way in which physicians practice medicine and collaborate with other healthcare professionals. Even just 2 years ago, clinical integration was not well understood, but today it is a main focus in the healthcare reform. Clinical integration is the direction that healthcare is headed, and while providers may be skeptical at first, this is a collaborative shift in the approach to healthcare service quality and delivery. Clinical pathways, collaborative practice groups, and case management systems provide the tools, roles, and systems necessary to integrate care at the level of the individual patient, patient population, institution, and integrated delivery system. Continual advancement and evolution of these tools, roles, and systems, along with the marriage of information system strategies, are essential for survival. And that concludes my presentation on the challenges of multidisciplinary clinical integrations into healthcare. I hope that you found my slides to be informative, and here is the list of references that I used for my slides, as well as the websites that the images came from. Thanks for listening!